Welcome to The Hidden Load for the educators and leaders in medicine who hold everyone up. We will tackle the hard topics and help you conquer your chaos and get to calm, all by starting to acknowledge and remove that hidden load. This podcast is a space for us to name the things that are common but not normal. Each week, we'll look at the invisible weight you're carrying and explore practical coaching-based tools to help you find more calm, better boundaries, and a sense of purpose that doesn't require you to run on empty. I'm so glad that you've carved time out for yourself today. Let's get into the episode. Welcome back to The Hidden Load. I am Dr. Santina or Tina Wheat. Usually, we talk about the hidden load within the walls of a hospital or of a residency program. But today, we are stepping into the world of private practice and multidisciplinary care. Our guest today is Dr. Maria Sokolina. She is a powerhouse in the world of Airway Health and dental sleep medicine. She is the founder of Harmony Dental Arts, a diplomat of the American Academy of Dental Sleep Medicine, and an author. But more importantly for our conversation today, she is a leader who has navigated the invisible pressures of running a practice while also trying to change the way that we think about breathing and health. Maria, I'm so glad you're here. Welcome to the show.
Thank you very much. It's really generous introduction, and I really appreciate being here.
I am so amazed by your background, having been born in Russia, trained in medical school before dental school, traveled to the Galapagos and Ethiopia to be able to study evolutionary biology, which is so amazing. And I hope to get to that myself one day. But how did this global medical first perspective lead you to focus on the hidden epidemic of airway health?
I usually say it's a start from fear. I find the fear a very kind of a moving force for me personally. Like, to get to the short version of that story, I was really scared what I do for people will fail. I guess my level of confidence in the beginning of my clinical career was very low. Maybe because I really like to see the results, and then I'm gonna, will believe it's true, or it's, like I have a very low trust, maybe due to that turbulent history what I have. So I had that fear that it's gonna fail. And because of that, I really was exploring the specialties or questioning the treatment plans or questioning the information I was taught in a dental school. So through failures, I learned what if I just do beautiful restoration, but I don't pay attention to, forces, they're going to fail. Then I put the teeth in, they might fail. Like, I don't want to get into technicality of that. All of a sudden, I realize what my patients grind and apply such a huge forces on the restoration I put in or on a setup of the teeth I, position orthodontically, because they cannot sleep and breathe in a proper way. They're applying the load to actually breathe at night. So that's how I get into dental sleep medicine, and it was 15 years ago. And then I realized, oh my God, I have a root cause. Now I can logically build my treatment plan. I can logically do things. If I'm going to protect that from that invisible forces, I can actually admire my high, skyscraper, or, whatever I build for patients in the mouth. So it was, that was fear, or maybe a desire to create something long lasting for my patients.
That is absolutely amazing. And I love that story. I think that so many people can relate to this feeling of feeling the fear of not doing a good enough job, of not making enough of a difference for their patients. I definitely know that I have that fear of, am I going to miss something? Am I not going to have the right treatment plan? Am I not going to do this? But what an amazing story to be able to build something positive out of that thing that often weighs so many of us down. That's so inspirational. So tell me, you proposed the idea of behind the smile, the reality of running a practice. And in my world, I feel like the hidden load is often some of the things that are happening behind the scenes, the administrative red tape. And in your world, you were a business owner in addition to being a lead clinician. What does that look like on an everyday basis for you? What do you actually feel for that load?
Heard that phrase, what actually doing dentistry or practicing medicine, that's the easiest part. Everything would come with it. That's the hardest part. Or another expression, your stuff can make you or break you. So we're talking about red administrative tape or actually whatever happened behind the scenes, which as important, but actual treatment, because that atmosphere, what you create, of course, maybe 200 years ago, maybe 100 years ago, a clinician can practice on his own, maybe have, one person next to him and do the business. But in my world or level of care, what I provide, I learn long in the beginning of my career, it's not possible. I'm not going to be able to help people being by myself or with a very limited group of people. So now we're talking on everyday basis. I find what that's most difficult, the most hidden load what I have is a team. Team what support me, what support my philosophy. I That's another level of fear. I was really scared what I'm not gonna be able to do what I really believe in. I I really want to practice how I want to practice. That was my dream, and that's why I'm in that field. So I was really scared it's not gonna happen. Yes, just like your podcast, I can relate. I was working in hospitals and I was working in a, we can call it group cleaning. So somebody else managed the administrative load. But at that time, level of my unhappiness was not in a hospital. Hospital I love. It was my residency program. So, I really like what um, responsibility was on my attending shoulders. But when I joined the group clinic and I was that was my responsibility, even though I didn't carry administrative load, practice in the environment, I did not feel comfortable practicing, dentistry or medicine, in my case, it's both, dental sleep medicine. I really didn't feel I'm bringing any good to people who come to me. So I have to get to that road road trip what I'm having, I'm on right now, and how regular they look like. Right now, at this moment of my life, it's actually, I can say, under control. But, that many years, and it's never 100%, but many, many years, I would say first 15 years of my practice, it was constantly on a shaky ground because I was not able to create the team. I was not able to get to the point what I can um, share the control of, let it go. I did not let it go completely, but I do trust people at this moment, people who support my philosophy. And this is, I know that feeling, and that's for doctors, either they, even in a hospital or in private practice or in a clinic, even in that environment, we're wearing a lot of hats. And we have so much responsibility, what it's applied on every single area of our life or, professional life. Yes. So that was a big revelation. I read a lot of business books and I learned about the system what I have to create to be able to let it go at least a little bit or to trust the system, to create multi-level system. I think that's very important for private practice. Hard to say for people who work in a hospital because I think they go into that system where they can, that ladder or hierarchy already created. And they just have to select the right people who they can trust. But for the private practice, you have to find those people, hire those people, train them according to your principles, and then let it go. So I find it challenging, but if I can ever recommend to young doctor, how to act, I would start with that principle. So that's the end goal That's what you want to create, what your uh, car, your mechanism work without you, and that should be the goal. That's gonna give you the joy of practice, joy of practicing, joy of coming to work and create something with your brain or with your hands, whatever you do. So that's
There
my
is so much that I just want to unpack there that I absolutely love. So first you were talking about the challenges of being in a group practice where you weren't really in control. And if I can sort of put words into your mouth, when you're in those group practices, you don't have the autonomy to be able to practice how you want to. You're following somebody else's instructions, right? And so then you decided to go out on your own, which there was fear of that because you had to do something that was different. And then you had to be able to share your vision, which meant that you had to find people that would be able to understand and support your philosophy that you were sharing with them. And then ultimately, I'm going to say you were able to delegate in creating these systems because we have to figure out a way to do a model that's sustainable. And that means creating the systems, being able to hand it off, training them in the right way, and being able to trust those people. That is all three of those things, or more that I just said are such important pieces of every leader's journey. Even if you're in a group practice, even if you're in an academic setting, if you're going to lead in any way, at some point you have to tackle each of those items. Letting go of the sadness of how much the not having autonomy is there, realizing that you have to share your vision of how you want to lead, creating the systems to be able to allow it to work and not have everything all riding on you because it just can't all ride on you. Um, there's so much that is good that's right there. So tell me a little bit, um, in addition to managing these teams that you have to have in order to make your practice run, you're thinking about your patients too. And it's difficult for many of us to switch off at the end of the day, to stop thinking about those patients. Can you give us an example of a patient case that maybe stayed with you where that clinician part of your brain didn't want to turn off even after you turned off the lights in your practice that day?
or in the beginning of my career, I can I was not able to imagine to switch the light off. Like I would be praying on my drive home what I'm gonna be able to fall asleep. Maybe that's part of why I, start interested in the sleep because I had a lot of problems myself with insomnia because I would play with the case, what I would do better, how can I improve, like constantly off. I know there are some tragic cases, of course, tragic cases, what you just amazed if you can change the course of the human life with your knowledge or with your experience or with courage actually to be able to convince somebody to go into the different route like I put in my book. Actually those two stories what I put in a book, they happened with real people. One of my close friends fall asleep and did not wake up, and he was a heavy snorer. And mm, you know I suspect what he has sleep apnea, but he didn't want to listen and, have a sleep study. So he fell asleep and didn't wake up. He was my patient and my friend. So that was really tragic. And of course, I, loop that for the last 7 years. Then we had another even more amazing story that was also my patient, but in the same time, husband of my dental assistant who also had a sleep apnea. And with him, I really encouraged him to do the sleep study, but he had cardiac arrest. And it happened in the morning. And luckily, she we have a CPR training every 2 years, and she was able to do the CPR and actually revive him. And I find that's amazing story. That's a happy story. Of course, you don't feel that terrible needle in the heart, like when you wake up at night and you feel like, oh, and now you're definitely not going to be able to go to sleep. But even on a smaller level, I think in our field we're dealing with people, and in some way we feel guilty or we feel we can do more. Oh, yes, that's exist. But in the same time, I think with the experience, and that's actually my message to younger practitioners, it will get better. It will get better because you be able, like intuitively, somebody somewhere gonna let you know how to prevent situation from happening. Like if you feel okay, in my field I can redo something before before the end of the procedure, I can do it better, and I'll just say, take a deep breath and just redo it, and then I'm not gonna wake up at night killing myself with the guilt. So that's one story in my case, but also with experience, you learn how to see through the situation just to prevent something really unfortunate from happening, or you become more encouraging, or maybe in the same time with the experience you sound more confident and your words have a heavy weight and people actually listen. So that's a combination. Experiences Experience will it'll take years to get experience, but experience give a lot of benefits. I would never believe I get to that point, but yes, experience is great. It's a luxury.
One of the things that I find to be really valuable is when you can take those personal stories and turn them into advocacy. You just mentioned the story of your friend who you died from, you believe, of sleep apnea. How did that help transition your professional advocacy, specifically around sleep medicine?
Like sleep, I personally love stories. I'm crazy about the stories, but in the same way, I attend a lot of courses, and what I learn, what people get attached, emotionally attached to the story, not to scientific fact, not to the quality of research and amount of cases what you use to produce that result, but they get emotionally attached to the story. So in my advocacy, in particular way, I have several hot topic or favorite topic to my heart, oral systemic health, how dentist or dental practitioner can see many, many things in the mouth. That's one of the stories. Of course, I'm passionate about sleep. I have the luxury. I have that opportunity to listen to the patient's story. People ask me how, as a dentist, I can listen to the patient's story. But truth is, it's not, yes, we do the procedures, but if we do long procedures, most of the time I work, but my patient can share. And, during the appointment or before and after, I can find out so much because, as funny as it sounds, that part is part of the human body, but it's also attached to this specific person. And to provide the treatment, I have to understand that person. So I'm so eager to learn. And because I see patterns what repeat and repeat and repeat, I have that opportunity, love for stories and love for writing. So I can create my advocacy in the shape of book, in the shape of article, and people read it, and it's kind of like extension of they can listen to what I said, they can read in the different forms, they can visualize because I do produce some social media content related to the topics what close to my heart. And another thing, I'm trying to uncover a lot of hidden topics because science is not a closed book, so I'm trying to educate people about what I know in an entertaining kind of way.
Absolutely. I want to go back a little bit to you running your practice and how that feels with your team. You mentioned earlier that one of the things that you had to learn along the way was that you could not control everything as much as you would have liked to. What was the breaking point, excuse me, that forced you to start realizing that you had to trust your team or the managers in your clinic and share that load?
You know, I'm going to talk about several points because I'm sure among your listeners, you have private practice or people who think about private practice. So, one thing early in my career, I had a case of, how to say, mistrust. Somebody stole huge amount of money from the practice. But that time, I was so confident what I control everything. Like you not in the early beginning, you kind of, you know, like you already know your way and you think you audit this and you audit that and you audit this and you audit that. And I was so shocked. Then on a Memorial Day weekend, I received the letter of somebody admitting what she did. And she was doing that continuously through the year. And she was so, I have a weakness towards people who love organization. So she was so organized. And I really like her. And, she got a little baby. And, I support, my practice, not so huge. I have around 20 people, but every person in my practice is a star. So I'm attached. And this one, she was on a frontier. And I was thinking, I spent most of my time trying to check everything, trying to control everything. And I missed that. I was shocked. Of course, this money, I never saw those money again. And, God bless that person. I wish her best. So nothing happened with her either. So if somebody thinking what they can find justice, don't waste your time. So that's my another advice about that. That actually, it's negative example. It's negative answer to your question, what you can't control everything. So I realize doesn't matter what I do. It cannot happen. If I want to focus on my patients, I cannot focus on administrative load. And for me personally, I love the practical part of the practice. Some people like the business part, but even for them, that story, you can't control. But then at certain point, I was always wondering about business coaching. I thought, okay, I made a mistake. I don't have a systems. I was able to miss huge amount. I'm going to hire a business coach. So I hire a business coach. Maybe I didn't make the right choice. I don't know. I learned a lot during that process. She brought great ideas, and maybe she brought that idea of creating the system, what I have a managers for the department. Maybe that was her idea. Or maybe it was a books what I was reading on the same topic in the same time. So I divide my practice into different departments, 4 departments. And I find, for some practices, they don't have to be big, but you can still divide and find, designated person in charge of that department, designated person in charge of that department. And when you give people responsibilities or like you promote them into leaders, even they don't have a big team. It doesn't matter. That changed them inside. That I learned. I learned what just like wearing the different hat, but now they're director of the administrative department, director of the clinical department, director of the medical department, I don't know, director of hygiene department. Just that idea changed people. And I start conducting the business meetings. I start doing it, like as a corporation, even though we're small. But that was a very positive experience. It didn't happen right away, but at certain point, with repetition, people like being in charge. People feel good about themselves. And I feel good. I admire that. Like
It's amazing.
I see people who, you know, I hire people in the beginning of their career, but they've been with me and they grew, and now they're in charge of that department. And they say, "I'm going to change this in my department. I'm going to do this in my department." Maybe I'm not, you know, in the beginning. I have to change myself because yes, I have my ego and it's my practice. and I sign the paycheck, but it doesn't matter. If I'm going to do that, then I'm going to keep going through the same loop over and over again. And, so I realize I can't control everything. I have to give, responsibility and change, not being so, narrow minded, give people freedom of making a mistake. That's probably the golden word. People can make a mistake, and you have to say, you made a mistake, or how you gonna correct it. Not jump into that, oh yes, now I'm gonna be the hero, I know how to fix it. So
And I think
that
you're just
yeah.
Yeah, you're absolutely talking about one of the, I feel like, hardest parts of leadership, but that I talk about a lot with delegation is that one of the benefits of delegation is that you're giving people the opportunity to grow. You're giving them the opportunity to stumble. You're giving them the opportunity to see what it is that they might be good at that you and they might not know that they might not be good at. And like your point about the, oh, I'm going to change this, that one of your employees might say, sometimes they have better ideas than we do. Like I've definitely had team members that have surprised me with the, oh, you want these things to happen? Okay, well, let's do it this entirely different way that I would have never thought of. And they can just be creative and allow your systems to work even better when you just give them that opportunity.
You're
But it's a hard
absolutely
lesson to
right.
learn.
You're absolutely right. That and I think even for our field, that's so hard because we were taught in dental school, if you make mistake, that's going to be you, that's going to be you. So you have it engraved somewhere inside
Mhm.
your brain. And
Yes.
then you have people who didn't go to dental or medical school, they didn't have that training, and you feel, oh, they might, they don't have that set. you know, yes, you're in charge of your patients. Your patient, you have to take care about your patients. But some other things they can manage, and you have to let it go. You have to trust the people around you because it's certain, you cannot do it yourself.
That is, those are such important points for leaders in medicine. So I do want to switch a little bit to our patients. You said to me earlier that you just can't make everyone happy, but you can still be compassionate in that care. Can you tell us a little bit about how you draw the line when a staff member, or really in this case, a patient, is unhappy? How do you keep your compassion without letting that dissatisfaction that they have become your hidden load? I feel like that's something that so many of us are facing, especially now. The in the era in the time of like the Yelp review for every physician and dental practice that's out there. How do you manage that?
That, you know, there are several, strategies I have. Yes, of course. It used to give me cold sweat. Somebody gonna be unhappy with my work. They gonna, spread the word, negative word. That's gonna ruin my reputation, my practice. Oh my God, I'm gonna be, you know, starving. You know, yes, we can catastrophize that to no extent. So I have several points what I make to myself. If somebody unhappy, first of all, that's why they call patience. I have to be patient with them. And they are my patients. They came to me for help. So this by a priori, without no questions, they are right. And I'm sorry for misunderstanding. I say that right from the start. And that's one of the principles what I taught my staff. Of course, people might call and express, and it might not be related to my work or to the work of my staff or to my practice or to my area at all. It most likely it's something else. But they had a difficult day, difficult week, difficult life, and we are sorry for that. And we really sorry for that, and we apologize for that misunderstanding. And like I always instruct my staff, you don't have to get, really find out what they are unhappy. If you hear that music in the voice, you start with that wonderful phrase. And then you ask, how can I? How can I help to make it better? Just start from that. They might continue with that story and music and abusing and, all of that uncomfortable song. But then at certain point, they will express what they want. And sometimes what they want, it can be very simple. And sometimes they just want the word of apology. They just want that. They just want to hear what you understand the pain and you sorry. It doesn't matter if you didn't cause it. And it doesn't matter if you really try to help them because it can be so much deeper. And you don't, I'm not in that field to find out why is that. So I start with that. I think I oh I don't want number two, if people have a team, I want my team not to bring every single accident to me. If an accident not related to treatment, it can be, somebody didn't say hello, somebody was not right with the payment. They have to learn how to resolve that. If it's not a health issue, they have to manage that. That's very important because, in the beginning, I was involved in that. In my field, um, it's a private office, so financial questions arise. Those questions, I don't want to be involved. Not I don't want to know about them. I want to know about them, of course, but it should not happen in a patient being nearby at all. Like I'm away from that. I'm responsible for the health issues, for pain, for infection, any type of troubles with health, financial. That's the different department. So I think that's very important for doctor not involved. Early in my career, when I was just in the residency program, I have that famous story. I was in the residency program, and one of my attendings giving us a lecture and said, "You have to lead." And I'm like, "How can I lead? I cannot lead myself. I don't know where to go. I don't have a clue." And I was kind of new in United States, and I was new into that profession, and like I didn't know how the system works at all. So, and I look at them, at him, like I'm totally puzzled. But then I learn, I'm a compassionate person. I'm compassionate by nature, and that's how I'm gonna lead, and that's how I want my staff to act, with compassion, because people come to us for help.
I love that. And I'm sure that watching you be compassionate allows your staff to see how to do that too, because I feel like that's one of those things that
That's
we
important.
need to lead by example and show others that this is an important part. This is like, yes, it's a business, but we're also there for others. We're caring for others in this business. And so we have to make sure that we're compassionate in that care.
Yeah, important
So we are
all the work.
getting to yeah, we're getting to the end of
Mhm.
our time. Is is there one thing that you wish that you would have really learned earlier that you would give as advice to somebody that's considering starting a private practice or considering taking a medical director role where they might be in the setting where it might be like they're doing their own mini private practice? Is there just one little tidbit that you wish you would have had before?
For me personally, as I mentioned earlier, I think the biggest obstacle I had was a confidence. Like for me, confidence come with experience. So, if you don't have experience, you don't have confidence, but it will come. You're going to start and, confidence arrive. Another one, what you mentioned, several times, leadership with compassion. We're dealing with people in the medical field, either our employees or our patients. You have to be compassionate. You have to set the rules. You have to follow those rules every day, and you have to lead by example, all of it. true. And from me personally, I we don't have business education in a dental school or medical school. Yes, some people come with the previous business experience. Some people take MBA. My recommendation, I didn't do, I didn't have both. I was reading business books. I think that's very valuable on a different level. It's not necessary, it's not nitty gritty business, but there are a lot of books what business owner or leader can read and learn and use, uh, those stories, and they're gonna help to lead, you know, they're going to help in that journey, either private practice or medical director role. And right now, besides the books, we have, Instagram, we have a social media, we have um, YouTube videos. Like, for example, I like Story, so I like Story brand by Donald Miller. I find that useful for me. I like the marketing part of the business. That's very important, which I didn't have a clue when I just started. So marketing, like you have to educate yourself all the time. And I think it's much easier now than it was, X amount of years ago when I started. So, we have to constantly educate ourselves. And it's going to be some areas, and that's very important, and it's really hard for me to accept what science is not a closed book and life is full of surprises and only change is permanent. That very hard concept for me to accept. Like, I feel sometimes, okay, I'm done this, now it's going to be failure proof. No, it will not.
Such an important point. And I don't want us to forget to mention, you mentioned books in there. You yourself are writing a book, and it's called Breathless. In it, you are talking about the importance of mentorship, excuse me. Can you share with me why you think having a mentor or a collaborative circle can be the antidote to isolation, especially if you're in a situation like private practice?
That's such a topic so close to my heart, for many reasons, of course. As an immigrant, I imagine, I'm very imaginative person. So I imagine when I arrive to United States, I'm going to meet a mentor, for example, an NYU dental school, somebody who I'm just going to follow. I'm going to follow, I'm going to improve my English. I'm going to understand how it works here in United States. No, it did not happen. I had a lot of, faculty members, but I had somehow close or not so close connection with them. But, mentorship did not happen, or it was a mentorship as I imagined that. So that's very important. Then I got into residency program, and that I absolutely love. I love the level of mentorship I got there, but it was not the mentorship still, but I imagined. And then I said to myself, I'm going to find the employer and I'm going to work for somebody. So I'm going to learn from that person on everyday basis. He's going to, or she going to practice next to me, and I'm just going to absorb all the best practices. That didn't happen either. Because actually, when I was writing my book, or even before, I realized such a diverse profession as we choose medicine or dentistry and business, there are so many people who must be your mentors. And it just like a college or medical school, you learn from multiple people and you learn from your patients on everyday basis. So one mentor does not exist. If somebody dreaming of getting one mentor, or how it happened in academia, I know it happened that way in academia, you're limiting yourself, because it has to be more, because life is so diverse and challenges are so diverse. So that's number one. Don't limit yourself to one mentor. Constantly, learn that subject from that person, that subject from that person. And it's very important, or at least I reflected in my book, if you have a colleagues who kind of on a parallel track with you, and you make an effort to meet those colleagues, mirroring your people who are going in a parallel route, that's the very good mentorship, because you're listening to their mistakes, they're listening to yours. You can together, you can change the course of action. You learn from that, or just by observation. Conversation is the best, but sometimes just observation. If somebody give the opportunity for you to listen to the story, that's a lot. So isolation, that's the straight road to burnout. That's like you get on a highway and just driving, make an effort. Like I put it in a book, but it's true story. But I have a colleague, I have a friend. We meet once a year for dinner, in New York restaurant. We have that tradition and we follow it. Yes, I make an effort. I make a reservation. I arrange the date. I do that. She's important to me. That's, and I have some other colleagues who we have a tradition to connect over the phone. And I have a podcast just like you. And I interview a lot of my friends and colleagues, and I learn from them, and I share with my audience, they experience and they, successes and failures. And I learn that way. That's the wonderful way. So, number one, don't stay silo. I know life is very busy and people have families, but just family and work without any other outlets, that's the road to burnout as well. So that's my recommendation, to make an effort and connect with wonderful people like you. Podcast is a great way. Listening to the podcast, that's a great mentorship.
I love that.
You just put it in the ears and you have your life lesson, and you learn, from Santina or from me or, from many other clinicians who sincerely share their story.
I love that. The mentors above you, the peer mentors, the mentors that maybe you don't know that can still make an impact. And you're right. That's absolutely why I started this podcast, was because I wanted others to know that many of these experiences we feel like we're going through alone, but we're not going through alone. Somebody else is doing them right next to us. We just don't know because they're not necessarily talking about it. Maria, I have really enjoyed having you on today. I feel like I could keep talking to you forever. If my listeners would like to find you, how do they do that?
I have a website, drmariasokolina.com, but I'm on a social media under my name, Dr. Maria Sokolina. I have a Facebook group, Sleep Apnea Snoring Breathing Help. I have a YouTube channel. I'm on a LinkedIn under my name, and my book called Breathless, where I share, sleep, breathing, and business experience through the story, family story, medical mystery, where I try to uncover modern life challenges and how they really detrimentally affect our health. But then I put some other moments inside of the story, like we talk about mentorship and business and building a practice and challenges. So I would be very happy if your listeners show me the reaction on my book Breathless. It's going to be released in the end of June. And if that book gonna help them to see the world a little bit different, I'm going to be thrilled. So thank you for that opportunity. I really enjoy our conversation. And you point out to some, aspect maybe I don't think about every day, but if, people can connect with me on the social media, and if they have some further questions and if my experience can help them, I'm going to be so happy.
I love that. And I'll make sure to link your website and your contact information in the show notes so that my listeners can find you. To my listeners, I'm so glad that you came today. And remember, leadership does not mean carrying the weight alone. It means building the structure and the systems that allows everyone, including you, to breathe a little easier, literally and figuratively. Thanks again for joining me. This has been another episode of The Hidden Load, and I look forward to seeing you next time. Thank you for listening to The Hidden Load. If today's conversation spoke to you, I would love for you to share it with a colleague who might need to hear it too. It's one of the simplest ways we can start shifting the culture of medicine together. And remember, your time spent reflecting here matters. You can earn free CME or CE credits for listening to today's episode through the Pinnacle app. You'll find that link in the show notes. If you are looking for one-on-one coaching support or want to dive deeper into the resources we discussed today, let's connect. You can find information on how to reach me in the show notes. And don't forget to hit subscribe so that you never miss an episode. And leave me a rating so that others can find me too. And take care of yourself because you deserve to be held up too. And I'll see you next time.